Hi everyone, I'm Zing, part of the community and partnerships team here at SGInnovate. A big thank you to everyone for joining us today to discuss the often overlooked topic of mental health. In case you're new to us, SGInnovate is a deep tech talent venture ecosystem builder backed by the Singapore government. We help entrepreneurial scientists discover and launch impactful deep tech solutions from Singapore to the world. Many of these solutions hold tremendous potential to solve challenging issues and improve lives, environments, and economies in many areas from food to healthcare. We do this by investing in people and companies with ideas and solutions to tackle tomorrow's toughest challenge through technology. Our talent develop programs to build and groom deep tech talent to support Singapore's thriving deep tech economy, while our investments approach focuses on supporting early-stage companies, particularly those heavily rooted in research and requiring specific capabilities and a high degree of specialization. To support this growing ecosystem, we are also home to Singapore's fastest-growing deep tech community of close to about 70,000 founders, researchers, corporates, and talent within our international network. As a community, we host events like this where we share ideas and create opportunities for collaboration. And it is vital that we are able to explore the use of deep tech to tackle critical issues like mental health and well-being. Mental health as an issue is not unique to Singapore and is central to the overall health and resilience of the global economy. Anxiety and depression alone cost the global economy about $1 trillion a year. And additionally, mental health issues also affect anyone, but diseases like depression often disproportionately impact women and people from lower income groups. Fortunately, fields such as AI, machine learning, and data science are changing how we diagnose, treat, and support people with mental health concerns. As the global burden of mental health conditions rises, we need to find a way to catalyze more of such innovations and collaboration in this field, tapping on research and piloting emerging technologies. We can achieve this by bringing together the strengths of startups, corporates, academia, and the public sectors to develop a more coordinated and sustained response and support framework in Singapore at the national level and beyond. I'm looking forward to today's discussion with Dario, Antoinette, Maithili, Janice, and Keith, and invite you to participate in the conversation. Please post any questions to our experts in the Q&A box below and share your thoughts with us in the chat box. With that, I would now like to pass the time over to Jun Loh, the HealthTEC Consortium Manager, for a few words. She'll be sharing more about HealthTEC and the inspiring work they're doing to support the development of health and wellness technologies in Singapore. Jun, please.
Good afternoon, everyone. Thank you for joining today's webinar on the state of mental health in Singapore, co-organized by SGInnovate and HealthTEC. My name is June. I'm the manager of the Singapore Health Technologies Consortium, in short, HealthTEC. It's my pleasure to be part of this event, and we are extremely privileged to be able to bring together esteemed industry leaders to share with us their insights on this emerging and very important topic on mental health. I would also like to take this opportunity to introduce to you about the HealthTEC Consortium. The consortium was established in July 2019 and is funded by the National Research Foundation. It is currently hosted at the Institute for Health Innovation and Technology in NUS. The consortium serves as a platform for interaction and collaboration between industry and academia to develop and translate innovations in sensing technologies and analytics or AI for health and wellness personalized applications. Member companies who are keen to explore project collaborations with the academia will be able to tap on the HealthTEC network of experts at the various institutes of higher learnings and research institutes, and the consortium provides seed funding to support the projects, among other things. Currently, we have 31 companies on board, as well as 9 RHLs who are our academic members. I'm happy to share that Bonfire Health and Safe Space, 2 of our speakers today are industry members. If you have any scope for collaboration and would like to know more about HealthTEC, please do reach out to us after this session or visit our website at healthtech.sg. Without further ado, I look forward to the panel discussion, and I hope you will enjoy the session and gain valuable insights from the panelists. I will now pass to Dario Heymann, Chief Research Officer at Galen Growth, who is the moderator of today's discussion. Over to you, Dario.
Thank you, June. Thank you, Zing. So a very warm morning, afternoon, and I've seen that we even have some people tuning in from the United States. So also a very good evening to the people who are on the other side of the globe. A very warm welcome to the State of Mental Health in Singapore, and I will be hosting this little session today, and I'm very pleased to have some very nice industry specialists with me. Before I start introducing all of them, I've prepared a few slides just to give you a brief overview where we are at the moment with the state of mental health across the globe. For those who don't know who I am, as I was introduced, I'm Chief Research Officer at Galen Growth, and we are literally working with all of the big industries and governments to help them return their ROI on digital health much more efficiently and effectively. By doing this, we are working across different verticals, and everything is based on the digital health analytics platform called HealthTEC Consortium, from where I'm going to share a few of the insights today from. So let me actually give you a bit of the thematic overview before I then deep dive into the discussion after. So where are we at the moment with digital health out there? So first of all, as I was saying, is I'm going to draw all of the insights that I'm going to be sharing with you out of HealthTEC Consortium. We are currently tracking close to 21,600 digital health players, out of which 7,500 about digital health ventures out there, and we are tracking a bit more than 100 million data points at the moment. Last time I checked was 139 million data points on digital health ventures. When we look into the disease overall, so often mental health is all thrown into one particular bucket. But when you look into some of the WHO stats that have been released over the past years, it's been one of the more rising conditions out there. And any substance use disorders and the mental health conditions are actually taking about 13% of this, which is based on a prevalence of 11% of the global population. When we look into the top 5 conditions in mental health, we actually have depression, bipolar, schizophrenia, dementia, and substance use disorders. And all of these are really affecting many people out there. So when we are having, for instance, depression, you're seeing that out of the global population, it is at the moment estimated that 3.4%, you need to see this across 7 billion people out there, are actually at the moment having depression out there. During the COVID-19 crisis, you've probably seen tons of articles out there. We've seen that, for instance, there was a recent publication from Singapore. 9 of 10 Singaporeans are feeling that the lockdown and the restrictions that we really have in place are bringing an impact on their mental health. In Canada, it was 2 out of 5. In the US, it was 4 out of 10, for instance. And we've seen similar stats across all countries out there where such sort of reviews are being made out there. Things that are a bit more less important at the moment are the more impactful mental health conditions such as bipolarity and schizophrenia. Even those are still having a share of about 0.6% and 0.3% respectively. And so far, there are many ways to actually treat these sort of conditions, but with some of the newer developments in the digital health space overall, we are now seeing that many players actually trying to target these more in-depth mental health conditions out there and actually trying a non-therapeutic approach, going towards the digital therapeutics approach to start treating some of these diseases. And we look into the global funding here, and that's a stat that I had to extract from a report that we've published last year, is that in 2020, global funding has actually reached more than $2 billion in mental health, out of which 1.81 billion were invested across the United States. When you see the increase year on year, this is actually up 2.1x, so 210% as compared to the previous year. When we look into 2021, we're only half year point now, we've already seen $1.56 billion invested across the United States. All of the other regions out there, and you're going to see this on a later slide that I have, are lacking this in funding momentum, even though the importance of investments across digital health in mental health is important. We do not see that investors are really savvy about investing in the sector yet, and therefore investment and the digital health ventures in this space are not necessarily progressing as fast as they would love to. We look into the global ecosystem then. Here we're in Asia Pacific. 215 ventures are at the moment across Asia Pacific focusing on mental health. That's roughly the same number as what we see in North America. However, when you compare the funding with $382 million, that is just a tiny little fraction out of what we are seeing across the United States. The Middle East, on the other hand, is the smallest ecosystem with only 43 ventures and a total of 88 million invested across 25 years, significantly smaller than any other ecosystem out there. Asia Pacific is often a very populous market when it comes to ventures. However, the funding always lacks that of their Western Western partners out there. But when we look into the mental health overall, and this is a correlational chart, so any venture that is currently focused globally on mental health, what are some of the other conditions that they're also looking into? We are not looking into conditions here. We really look into some of the other therapeutic focus areas, how we are tracking it at the moment. Substance use disorder here is probably the only one that is actually a mental health condition. However, since it's such an impactful therapeutic focus on condition, we actually are classifying it as a separate order. When you look into the top 9 other therapeutic focus areas that we are seeing, that actually things like neurology, cardiology, substance use disorders, chronic disease, sleep, women's health, diabetes, and pediatrics are often in correlation with ventures that are looking to the mental health state overall. It's quite interesting when you look into that. When you look into the pediatric space, for instance, here you're talking about ADHD. For example, an example here was that Akili Therapeutics last year has received the first ever FDA approval for digital therapeutics, or a digital replacement therapy that is looking into the intersection of pediatrics and mental health. And this has really not, again, moved the momentum forward. And now we are seeing that more ventures are actually trying to also get an FDA approval or any other CE approvals out there from how they can actually now use their digital therapeutic as a replacement therapy, and therefore as a prescription therapeutic out there. Neurology, again, is a very interesting intersection. The more deeper you move into certain conditions, for instance, Alzheimer's disease, this is where you see that mental health from the dementia side moves over to the neurology side, and then the Alzheimer's disease are actually also having a correlation with one another. Therefore, you have certain ventures out there that are actually looking into the intersection and how they can actually treat or diagnose neurological conditions so early that it doesn't really develop into a full-fledged disease. Women's health, it's something that Ying was mentioning in the beginning as well. It's been a topic now for the past 1.5 to 2 years. It's an important one to talk about. And here we are seeing that there's also a surge in ventures that are actually appearing within the space, and more this tailored solutions that are more woman-centric and not this generalistic approach of actually trying to treat every condition how they are, since women's health and men's health from a behavioral point of view are often fairly different to one another. A last one that I want to mention on this page, and I can literally talk an entire hour about this, is when you look into the sleep space here. So you see certain correlations with the cardiology side here. You also see certain correlations with the mental health side here. And this is because sleep can be both more from a cardiology and then a respiratory side. So as well as from the mental health side overall. And this is why we see a very strong correlation here. And we've seen that in the past 12 months, there's been a huge attention towards the sleep tracking, not only from ventures, but now also finally from larger corporations such as medical device firms that are now actually looking into what's the mental impact on tracking sleep and make people sleep healthier again. So it's also a fairly interesting approach, and as I was saying, I can talk the entire day about this. When we look into Southeast Asia, and that's my last slide before I will start moving over to the actual discussion today, it's a very nascent space. We only have 30 ventures in Southeast Asia that are looking into mental health at the moment. That's a sheer fraction of what we actually see in Asia Pacific overall. And we look into Southeast Asia and the countries that are actually having digital health ventures focusing on mental health, Singapore actually represents 61%, two of which were sitting on my panel here today. Only 1 of 3 mental health ventures in Southeast Asia have received funding from institutional investors. Most of them are still funded by either angels or by accelerators, incubators, whatsoever. So there's really the lack of attention towards mental health ventures, even though it's such a major problem out there. And that's usually because investors do not understand the space. Investors in Southeast Asia are driven towards investing into high growth technologies, therefore more looking to the e-commerce side than into these that are actually mattering, and therefore mental health should actually be on their roadmap. I need to apologize, I have a little typo in here, but when you look into the therapeutic focus areas into that, when you look into the categories of the digital health space where these ventures are working in, 38% are more on the prevention side of it. So the wellness side, this is how we are classifying, it's the prevention side of actually developing mental health conditions, versus 27% that are looking into more the patient-centric, the remote monitoring, disease management sort of approaches under patient solutions. 19% are then becoming a bit more generalistic of just providing a telemedicine solution that is mental health focused. And we only have a very small fraction that are actually looking into diagnostics of it. So more the medical imaging side, more using any sort of trackers to see how you can predict mental health conditions. However, I think this is a very nice intersection to actually now open also my panel discussion. If you have any questions, drop me a message, I have a LinkedIn email. I'm happy to answer everything in a bit more detail. So over to my panel, and I would love to introduce everyone who's with me on this call today. So I have Antoinette Patterson, who's the founder and CEO of Safe Space. Say hi. Then I have Associate Professor Maithili Subramaniam. She is a very well-known mental health professor here in Singapore, has tons of publications. I was checking yesterday, I think it's 460 publications in the mental health space, which is fantastic. Me from an academic space, I have 5, I think, in total. So she is significantly better than me. Then I have Janice Wang, who is representing the governmental side today. Then I have Chief Wang, who's the founder and CEO of Bonfire Health, a very young, new digital health venture, also focused on the mental health space here in Singapore as well. So with this further ado, I would love to have each of you introduce yourself and add a bit more color to what I was just saying about you. Starting with Antoinette.
Sure. Thank you so much, Dario, for the introduction. Hi, everyone. My name is Antoinette. I'm the founder of Safe Space. We've been around for the last 3 years, so we saw the decline in mental health before COVID, during COVID, and now where we are entering this current situation of phase 2 restrictions. But before we get into that, who is Safe Space and what do? We are a B2B2C digital mental health care provider and ecosystem. What we really pride ourselves on is really preventive mental health education and really fast, affordable, and discreet access to therapy care. Whether it's online or face-to-face, you have the option for both. And we also support consumers as well as corporates, and especially corporates via our employee assistance program. Now, when it comes to corporates, there are startups, SMEs, and MNCs, and we really want to ensure every kind of company out there has access to an affordable EAP program. And we're really happy to share that since our launch of our corporate program in January 2021, our utilization is pretty high at 10%, reflecting what's currently out there in the market right now with COVID and everything, and comparing that to the global utilization at 3%. So thank you so much, and over to the next speaker.
Hi, I'm Maithili, and I work at the Institute of Mental Health. I'm the Assistant Chairman, Medical Board Research. I have been working in the field of mental health now for 20 years. And I would like to thank Dario for acknowledging my publications. It's one of the few things which really make me very, very happy in what I have achieved. And I never thought anybody would bother to count up other than me.
Always.
But thanks a lot for that shout out. I also teach. I teach at the School of Public Health, Soswi Hawk School of Public Health. I have a joint appointment there. And again, I teach only mental health related topics. But above and beyond being an academic researcher, and in a way, I'm also an administrator for a large number of mental health grants. but I think I'm an advocate for mental health issues. When we started way back in 2010, there was hardly any data on mental health. Hardly anybody was willing to give us space or time for mental health. And I think that has changed. And I'm very grateful to SGInnovate today for highlighting this very important topic in this forum.
Thank you. Janice, over to you.
Yeah, good afternoon, everyone. Thanks, Dario. So I'm Janice from the Ministry of Health Office for Healthcare Transformation. As our title suggests, we look at innovative ways to transform the healthcare sector in Singapore. So in particular, I lead the mental health and wellness team in MOHT. So we look at digital initiatives to transform the mental healthcare space. Promoting wellness is one of the key things that we look at. So we take a very social environmental approach to the work we do. My background personally is in social services and management consulting. So I used to be a typical consultant going around advising governments on how they should do their job better. But now I'm in the role to trying to do the job better myself. So that's a summary of what I do now.
Thank you. Keith, last but not least.
Thank you, Dario. Good morning, afternoon, evening, everyone. I'm Keith, founder and CEO of Bonfire Health. So we help large organizations improve health outcomes and drive cost savings by owning the entire value chain, from mental health provider sourcing to health program promotion, right down to measuring business results. So in a nutshell, we offer three pillars, three services. First, we are an EAP broker. Like an insurance broker, we work with a network of clinicians, EAP clinic providers to source the right plans for our clients. Number two, we drive the employee engagement. We know that EAP is seldom used, so we know that's a problem that we need to address by creating engagement programs, educational programs to keep employees engaged and aware of the service. Number three, we are also a tech company. We are a deep tech company. We have an employee self-care app that helps employees manage their own mental health when their line managers, HR, and even the counselors are busy. That's basically what we do.
Thank you. Okay, so to maybe kickstart the discussion, maybe coming from a bit broader point, and then we can slowly but steady narrow down. I would love to start with Prof. Maitali today. When we look into the mental health space and how it has been developing, you are in this field now, I think, for the past 20 years. I think your first publication that I saw was back in 2006. You've looked into many different ethnicities, many different mental conditions, so on and so forth. When you look into what happened 2 years ago, and do you think there should have been any other intervention programs that should have kicked in significantly earlier across the world to actually intervene against the rise of mental health that we've seen, or the mental health issues that we've seen over the past 2 years? Would there have been anything that could have been done better from the studies that you've published?
I think, first of all, Dario, there has been an growing awareness of both the importance as well as the increasing prevalence of mental health conditions. I think for the past 10 years or so, overall, globally, you can see multiple studies which have kind of highlighted it. You can also see that, you had many countries which were tracking the mental health of especially the youth, as well as, the other end of the spectrum, as you pointed out, also elderly, where there is, I agree, a strong kind of a dominance of dementia-related issues, but mental health conditions are also quite significant, and we have been looking at it. But yes, the COVID kind of, whatever said and done, although we kept saying we are preparing for a worldwide pandemic, in some ways we were, but we were caught quite short of our preparation. And this is not just in the field of mental health, but you could also see that, we didn't even have the basic PPE in place, which was such a basic requirement for a pandemic, let alone the mental health issues. But what kind of positively impacted me, I felt, was that for the very first time, there was a very quick announcement of almost a mental health pandemic this time, which almost never happens. They talk about the pandemic, but the mental health aspects of it are forgotten. And I was here during SARS in Singapore, where it did hit us pretty badly. I was, in fact, quarantined. My whole hospital was quarantined. It was one of those unique situations. A lot of us had a lot of anger, frustration, helplessness, I would even go as far as to say anxiety and depression, but we were almost scared to talk about it, or not in terms of like anybody's going to say anything, but feeling that as a healthcare worker, you're not really supposed to talk too much about it. But I think that this time, the early sounds, with early kind of waves that came from all over the world globally, talking about a pandemic, helped people vocalize their feelings and thoughts. And if you look at data which came actually from America very, very early into the picture, there were like these online sites which were showing that people are aware that they are anxious, they are feeling a bit low, and they had started like using self-screening, which had shown a tremendous increase over the months in 2020. And you could also see that the people who were unfortunately reporting medium to severe kind of depressive symptoms had increased tremendously. So that, I think, awareness is the first step. So that had definitely happened with this pandemic. Whether interventions are in place, I know I will not be very popular for this opinion, but sometimes I feel that even when there are interventions in place, there are too many other things that are happening which kind of prevent people from kind of accessing these interventions. And that is why this seminar is important, because you're talking about a digital kind of intervention where anonymity is preserved, accessibility in today's world, especially even in developing countries, everybody has access to a good phone and to a good service. And so that's why I think it is happening. But yes, we have Janice, who can tell you a lot more about interventions in terms of the Mindline SG, which came online very soon. I saw a lot of other online places kind of advertising, kind of putting themselves out there to help people. And some of them were, not charging anything. Some of them were charging very minimally. So it was not really a cost issue alone. But I still think that across the world, although it differs, I think that people are still hesitant to kind of go out there and seek services for their mental health issues, which still remains a bit of a problem. And even with online, I mean, you know this better than me. I'm not that much into the online kind of intervention space, but there is hesitation among the public to kind of just, you talk about it and they go out. So if at all there was something which I feel should have been done earlier, would have been to have these online spaces put up before and advertised before, and so that a trust could be built up with the population so that they would have used it more readily during this period of time. But I do think that there were interventions that were put up in place with this pandemic globally.
Oops, it looks like Dario may have some connection issues. Hold on for a while. And he is back on.
First world country, third world issues. I lost my internet. Am I back?
Yes.
Okay, excellent. I think my video, does it work again?
We can hear you.
Okay, perfect. If you, I'll probably also bring back now my video in any second at some point. Okay, now we can start. Okay, apologies. Literally, first world country, third world issues. Apologies for that. Probably then taking on where Prof. Maitali was just wrapping up with, at least the last point that I got, maybe moving in, Janice, into the conversation. When we look into the accessibility and how Singapore has set up an early intervention program, that was kind of the first point of entry when you were thinking about moving into opening a line for people really sharing their difficulties during these times. So was this even in place prior to COVID, but people didn't really hear about it?
Yeah. I think for us, it was a gradual realization that we really needed to do something to strengthen the mental well-being of the population during this pandemic period. So the circuit breaker, the first circuit breaker, I would say, is really that trigger point for us in MOH and in MOHT to really look into this issue. So we were starting to hear different institutions, ecosystem partners telling us about the rise in heightened stress levels across different profiles of the population, like the schools were closed. So we are hearing about parents having caregiving responsibilities on top of needing to manage work from home. So it's like stress, double stress, right? And in the foreign domestic dorms, we had a call for help as well to help with the mental health challenges of our foreign friends, and many of whom were afraid of losing their jobs, and they were very worried about the situation in their home countries. And then the next day, we will hear about the family domestic violence being an issue in the families, right? So, I mean, it was just, all coming together week after week of hearing this news of people having stress and how do we address it. So for us, I mean, in MOHT, we had some capability to develop some solutions quickly. So for us, we kind of came together with a few of the ecosystem partners like IMH, MSF, and CSS. And with that, we decided that a digital approach was the right way to address this issue. I think Maithili rightly pointed out, I think it's a couple of things. Stigma is a big issue in Singapore. So for us to provide an anonymous option for people to self-care, self-help is very, very important. And for us, that was one key principle that we went by when we wanted to ideate on a solution. Secondly, I think, with the pandemic situation, the way traditional services could be developed by humans were impeded, right? It was hard for the social workers, for the counselors to meet their clients. It was difficult to deliver human-based services. So we needed a way to bridge this gap to allow for more people to benefit from self-care, from knowing where to seek help. And that's, our thinking around when we should go in and the method to which to address this issue in Singapore.
Thank you. I think, Antoinette, for the past 3 years, I think you work roughly in the same space, trying to kind of bridge the counselors with people having mental health issues by also preserving their privacy.
Yeah.
You've probably seen a similar pickup in interest over this time. Can you kind of correlate to what Janice was just referring to as well? Yeah, can you see the same trend?
For sure, and it's definitely been a substantial increase in the number of users, not just users, but also clinical therapists who are now migrating to being online because they see the benefit of having both options to continue their practice should another lockdown happen again. So even on our side, we had a 300% increase in the number of users and even the number of corporate clients who are requesting for mental health EAP solutions. This whole thing is in its infancy, where people are still trying to figure out, what's the difference between a clinical therapist versus a life coach. When I choose a mental health technology solution, how do I vet one between another? What are some of the things that I need to look out for, like data protection, privacy policy? How are they actually protecting my employees' data? So on our side, we actually spent a lot of time in the beginning, especially when we first launched in March 2019, to educate the public first on mental health. What's the benefit of prioritizing it just as much as physical health? Educating HR managers on how they can actually vet employee assistance programs catered to mental health. And by the time the lockdown happened, we've been speaking to so many of them. We were thankful that we built the trust and transparency with them that they actually did reach out to us for some aid. So we definitely are aligned with Janice on that front, that there has been a substantial increase.
Thank you. And maybe then to you, Keith, since you work also very close then with the employers, have you seen that similar trend again? Have you seen that since there's now more awareness out there, you've seen a more active approach from the employers actually trying to take care of their employees much stronger, more interest in the EAP programs that you are bringing out there? What are some of the trends?
Yeah, absolutely. So we are seeing inquiries coming every week, 5 to 8, from large MNCs who are proactively asking about what is EAP, how does it work, how much does it cost, They're pretty reactive, frankly speaking, to the current conditions happening around the world and within the organization. But they are more aware, obviously, of the service. They know it is becoming painful, but they're still trying to figure it out at this moment. So we have seen Fortune 500 companies, the household names, who don't have EAP, don't understand how it works, and still don't know how to justify to their management team. And we are spending a lot of time in our first year, frankly, educating the market. But it has been very rewarding, very gratifying to see these teams from being aware to being better equipped to implement it within the organization.
Thank you. When we look into some of the mental health conditions that we are currently seeing out there, I know, and Antoinette, you've published a white paper recently. What are some of the more visible conditions that also some of these CEOs have been sharing? Some of the stress that they're having, is it more on the depression side? Is it more anxiety? And have there been some certain factors that they've said, this is really something that bothers me a lot, and this could be improved in order to make the mental health of myself and also for my team better?
Yeah, sure. So I'll just give some context as well onto what this research piece was about. So this was a collaboration with ACE, and it was actually initiated by ACE as well, because they definitely saw a decline in startup founder mental health, and because we were also conversing with them at that point in time, there was a collaboration piece to create a proper Singapore startup mental health founder piece when it comes to doing this research. So it was a 4-month study, and we were really highlighting the challenges that were faced by startup founders. So we actually really broke it down into, what was experienced during COVID, what was the difference between male founders and female founders when it came to their own mental health struggles, because it was vastly different as well. So for this webinar today, I'll just quickly touch on that for the time being. So what we saw was 59% of the respondents agreed, or strongly agreed actually, that running a startup has taken a toll on their mental health. 70% of them reported that maintaining close relationships during this time has been difficult and frustrating. The top stresses that they were experiencing was a challenging business environment because of COVID. Company cash flow was a very strong concern on their side. Challenging team dynamics also came up. And about 78% of them gave a very high score actually. So they scored about 8 in terms of the importance of their team's mental health. But 88% of all the startup founders that we interviewed did not have an appointed mental health advocate, but they knew the importance of it. They just didn't know where to go. If we look at it from a female founder and a male founder perspective, females were more likely to report cash flow issues and physical health stresses, actually, while male founders were twice as likely to confide in no one during this time. Females were tending to go to a support group, and they were able to rely on peer support and family support. So during this study, the need was very clear. They were looking for a mental health solution, and they were thinking that employee assistance programs are more towards SMEs and MNCs because they are all expensive. For Safe Space, we want to share that there are affordable employee assistance programs that startup founders can have access to. We've created a specialized and affordable one for startup founders, especially because for investors in this audience, you need to look after your startup founders' mental health, because they are the ones who are steering the whole company. Without them being mentally healthy, the company might crumble. So we need to make a stand here to look after the startup founders as well.
Thank you. Maybe taking some of the findings that you've in there over to Janice, maybe. When you read such studies, how does Singapore usually address any sort of findings from studies, let it be peer-reviewed journal publications, white papers? What are some of the ways Singapore tries to actually then implement better ways to respond to it, like responses to certain inquiries? I've seen in the Q&A section there've been also a bit about what are some of the plans that Singapore puts into play also moving forward to actually try to prevent certain mental conditions or to address them more effectively.
I would say Singapore generally takes a very systematic approach when it comes to policy making or to new legislations that we want to put out. So I think with this long-term approach, then any of the research reports that come up on a regular basis, I think all these are always taken into account when we do programmatic innovations or when we want to do new policies. But I think, it's important also not to often jump the gun, right? And as we say it, when we want to do new programs to address some of the new emerging issues that come up along the way, I think it's at least for MOHT, what we do is we do small pilots. And with these pilots, we gather new insights along the way. So it's a very agile method that I think we need to start to adopt when we want to, change some of the ways that we are doing things traditionally. And I think mental health space is really a great space for us to change this paradigm or to really change the way that we look at this issue and how we might want to address it. So I think with digital innovations, then we need to start to think of different ways of working, using research insights, using agile ways of working, using a trial, test, and evaluate method to really get things to move and to break some frontiers, right, in this space.
And has it been on the Singapore budget for next year? Has it been more of the thematic areas that gets higher attention now, or is it same as it was in the previous years? Has there been any major surge in it?
I definitely think that the government is looking into mental health a lot more in recent years. And I think the pandemic situation has really pushed everyone's focus, right? Not just the government, but private sector players, parents, schools, like private organizations, as Keith said, right? Like there's just tremendous interest in this space. And I think it's really good because for a long time, mental health is like the poorer cousin of physical health, right? Physical health has all the research money poured into it. And no one cares about mental health for the longest time ever. So I think this is really a good trend and we should tap on this, drive, this momentum to pick it up and address some of the really hard issues like stigma that Maithili talked about. How do we address this thing, that has been, in the black box for the longest time? I think that there are just many ways. I think the pandemic, I would say, is an unfortunate thing, but the fortunate thing is really accelerated adoption and acceptance of digital therapeutics, right? As you rightly shared in the beginning of your presentation.
Honestly, opening that big black box is, I think, the best thing that can ever happen to something. People haven't really talked about mental issues before.
For the longest time, right?
For the longest time, because it has always been a bit of a taboo topic. And now people actually start talking. We actually see what's the actual impact of it and how does it affect people. Prof. Maithili, you've been smiling in between. You must be very overwhelmed, I believe, at the moment. Things that you've probably seen 20 years ago and how you see them now, probably this accessibility to certain data out there, the awareness of mental health. It must have been majorly accelerated, isn't it? So when you see the interest of what you're doing, how fast, what would need to be done in order to actually increase awareness even more, also get more exposure also now to digital health and just working in the space? What needs to happen also from, let's say, a governmental side, from a private sector side, to actually accelerate now the implementation of certain intervention programs?
No, first of all, kind of just going back to what Janice has said, in a way, yes, the timing is right. And what we found in a study that I will be talking about later this August is, we found that for the first time, 82% of the people said that if they have a emotional or a we call it emotional or nervous problems. We don't call it mental health problems, but we said if you have an emotional or a nervous problem because of COVID-related issues, would you seek help? So for the first time, 80% of the people said yes. So I think what COVID has done is it has kind of united people, and they feel more comfortable saying that, everybody's having a problem. To struggle with some of these issues is no longer, a personality defect or a personal weakness of some kind. It is more acceptable now. So yes, I think people are more willing to seek help than they were ever before. And so we have to respond to that. And I think there is definitely a lot of things have changed. All of you talked about it. I don't have to say that I'm still remain more in the space of pure research than doing the interventions myself, but all of you have talked about it. But I do think we, and look, I'm always going to advocate for that. And if you get someone else, they are going to advocate for that condition. But I always feel that, yes, we could put in a lot more money from a government perspective on interventions. I mean, research is something which, it is what it is. You have to compete. I'm not going to ask for that, although I would like to, but interventions, yes, we need definitely more. And I think that we also need to support employers and help them to kind of have some kind of a way that we can incentivize them to provide these supportive mechanisms for their employees. I think that is needed, because what we tend to sometimes forget is that when we do all these things, actually there is a tremendous gain. I mean, I'm not trying to say that this should be the only reason why you're helping people with mental health conditions, but looking at it from a company perspective, there is a gain in productivity. There is a gain in the quality of your workers, and your workers are going to stay longer with you if you look after them. So I think that message, as well as some kind of incentivization, has to be there so that we don't forget this. My concern is always, it gets over and done with, and then we forget and we move on to something else. And I think we have a momentum here. We have to build up on that momentum and keep it going. But also from an employer perspective, I think it is not an easy time for them. It is not an easy time for the employee, because one of the biggest things that people express to us, which is causing them stress, is the financial situation for them personally and long-term unemployment. It is a real challenge. It's difficult for both parties. So again, the government has done a fair bit to, actually give out some kind of subsidy for various organizations. And it is difficult, but it has to be continued. And I think employers need to also take care of their employees beyond just the salary part. I had a new person who wanted to join me in my team. And one of the things he asked, which kind of really struck with me, was he said, "Are you guys totally online? Do you meet at all in person?" And I said, "We do, but very rarely." And he said, "I'm very scared to come into the team because, I feel that I will be very lonely and I will have to deal with problems on my own. I'll have no one to actually bond with." And that's something that we haven't thought about, right? Like, we assume that Zoom is so convenient and so fantastic, but I have lost touch with the people in my department. It is not the same.
It doesn't replace.
Yeah, it would be the same for every workplace. So are we doing enough to organize some kind of a bonding for people? Are we checking in with them? These are simple things, but are we doing enough of that? I think that's something we have to ask ourselves. And then, of course, it is also a personal responsibility that some of the services which are out there are really good. But I agree with Antoinette that people had to kind of trust, people had to do a search, people had to believe in them before they kind of signed up with them. But once that is done, we also owe it to ourselves and our own well-being that we take the treatment as has been decided and we don't drop out of treatment too early. So yes, I think it's everybody's responsibility, personal, societal, and governments across the world to maintain the mental well-being of populations.
Thank you. Yeah, it would be definitely nicer to actually sit next to you at the SGInnovate space than talking via Zoom with you. We can't really. Keith, Prof. Maitali was mentioning we need better support for the employers as well. What do you think was one of the reasons that you now get so many in interest and that hasn't been really before there? People really didn't think about EAP programs before. What was the pivotal moment, let's say, for EAP also in this part of the world to kick off much stronger and actually increase more awareness around it?
Okay, I think I lost it for about 1 second. So your question is, what was a pivotal moment?
For EAP programs to now actually start getting the attention also in this part of the world?
Right. So we did ask what were the triggers within the organizations. So some of the common reasons are that people are complaining. Employees are raising their feedback. They're feeling tension at home. They're feeling that they're not performing well at work. We have HR teams who are also feeling the heat themselves. They are concerned about their employees. They are concerned that the employees are not performing when they're working remotely. We have complaints from leaders, management, who was very concerned about whether employees are, actually showing up, whether they are actually, coping well. So there are feedback from different levels of the organization. They are responding to the pandemic in their own ways. So these are some of the triggers that we're seeing from the organizations.
Thank you. Looking a bit into the Q&A, since we slowly but steady move in there. There's a question that is upvoted quite a bit. When we look into local perception of mental health, and there's still lots of stigma, what could be done to actually increase the awareness around and the aversion to use mental health wellness services such as Safe Space, such as Bonfire? What would need to be done in order to move people towards it? Is it more governmental side? Is it more media need to go that way? What do you both think? So both Antoinette and Keith, maybe.
Sure. I could share from just Safe Space perspective, how we've been trying to reduce the stigma on our side. So one, there's definitely a lot of interest because people are trying to figure out how they can help themselves. They're trying to do it discreetly. They're just scared. So acknowledging their fears, and acknowledging that certain things like this can be scary. So the number one question that we always get asked, especially when it comes to an employee assistance program, is, if I use a mental health service provided by my employer, will this affect my performance review? During our onboarding, we make it very interactive, and we always use Slido for anonymous audience interaction, and we allow them to ask all questions that they want to ask. And we are also very honest with our own experience for mental health. I'll be very upfront and tell them, look, I went through burnout myself. I know exactly what you're going through. If you want to ask me any questions about how that experience was like, I'm more than happy to answer on this call. So when you build that trust and transparency with them, they're actually more likely to ask and to actually put their fears at rest. And by doing it in that way, to be very transparent with them, it helps them to utilize the platform a little bit more. On our side, because not everyone goes through a company program. On the consumer side, we do a lot of education via our social platforms. So, posting polls on what they think are the answers for certain topics, imposter syndrome, men's mental health, the stigma around that for new dads. So making it very open in terms of the conversation for mental health, trying to normalize the conversation has helped us a lot in building the trust and transparency to ultimately lead into utilization and regular utilization.
Thank you. Keith, anything from your side?
Yeah, I think there are two ways we can improve or reduce stigma and improve the perception of mental health within the organization, for example. It has to be top down. I think first of all, it has to start with the government, to the employees, and then within the organizations, the management to their employees, to their people. I think first of all, the government could definitely ask or nudge or even make certain policies mandatory. Like in Japan, for employees with certain headcount, they are required to do certain stress checks with their people. And that's required by law in Japan. Right? But in Singapore, we do not have such requirements, policies where employees should conduct stress checks on the people. At the organization level, management needs to buy into the service. They need to buy into the program. They need to buy into the culture of better mental health. And we learned that if management is not convinced about the value, they're not visibly vocal, they're not visibly supportive of these programs by not participating in it, then people are shying away from the service. People wouldn't think that this is the norm. People would think that management is still charging them for seeking help. So it has to be top down.
Thank you. I see lots of questions also around the mental health of children there are many different sorts of questions. So I tried to bring them a bit into one, and I think Prof. Maitali is probably the best person from a more research point of view behind this. When you look into what would need to be done, not just in Singapore, maybe even globally, to reduce the stress onto children. Here we have a question around the PDPA issues. Okay, there are always privacy issues. I think startups like SafeSpace and Bonfire are usually taking very much care of that. So the entire privacy isn't so much of an issue. Is it more that the parents need to be more educated? Is it more from the educational sector that need to intervene? Is it more governmental that actually needs to intervene? What could be done to actually increase child health for mental health? Do you have any take on that?
I mean, like, most things, it is multifactorial. And I think, yes, everybody has to do a lot more than what we have been doing. We have heard, and these are focus group discussions after focus group discussions, where people say that, even when parents are recommended treatment, they are worried. And I'm not blaming them. They are worried because they worry that would there be records kept of this person? At the end of the day, Singapore is a small country, and I'm talking here about Singapore specifically. But would there be some impact on this person going forward in terms of them pursuing their higher education, in terms of them getting a good job, further down the road? And that's a serious concern. And despite a lot of times what we say that these doctor-patient interactions are sacrosanct, people are worried. And I think one of the issues that unfortunately happens is that we often hear about cases where things go very wrong. They come up and, everybody knows about that case. And so we think, yeah, you see, something went wrong, and then everybody knows about it. And of course, sometimes what also happens is media, all the media is again pretty circumspect under certain situations. They do tend to associate mental health conditions with violence, or mental health conditions with extremely bizarre behavior, which again makes parents take a step back and say, I don't think my child has this. That's denial, because we don't want to go and have our child behave in this way. So that's the way they deal with it. The best way, of course, to deal with it is when we have, and this is happening, Dario, across the world, is when people step up and they say, look, I am what I am. And it's not always about success in the commercial sense, but success in whatever they are doing, and saying, look, I had a mental health condition. I was treated. People knew about it. It didn't affect anything. And here I am, and I'm doing so well for myself. We have had some very senior leaders in Singapore very, very recently talk about it. That's a game changer. That should assure parents that just because your child has a mental health condition, it will not affect their, the trajectory will still be the same. If you get treatment, they are still going to do very well. That's one part of it. But the other part of it is, yes, schools are doing it, but they need to do much more of it. How do we make sure that going to a counselor is no longer a stigmatizing issue? I've heard a lot of suggestions. Should we make it compulsory? Every child goes to the counselor, and then, there is no stigma around it. But then I worry, is it going to be a tick box solution where people just say, yes, I saw a child A, B, C, D, E, F, G, because counselors will be overwhelmed if that happens, right? But I think there could be ways in which these things can be overcome. I will not name the school. My kids went to a school. My kids had to see a counselor. And when they had to see a counselor, it could be anything. It could be a disciplinary issue. It could be an issue where it was check-in, where it was something more serious, but everybody could be called anytime. It was placed in a very general admin kind of an area where nobody had an idea where this kid was going. These are very simple things. And the counselor also would not communicate what was happening to the teachers, to other people, unless and until it was something where it was life-threatening, or the child talked about harm to self or others. So these are some of the things that we need to do it better. I'm not saying it's not happening, but we need to do it much better. And last but not the least, as I said, is the role of media. Again, media has started highlighting in Singapore positive stories, but we need to keep that going, because you have 10 positive stories and you have one really negative story, and everybody forgets all about the positive stories. And so I think those are some of the simple things that we could do. But yes, above and beyond it, sustained funding above and beyond it, the ability. Now, again, I just noticed, because I'm not very good with technology, so I didn't look at the chat. I get distracted, but I did see somebody talking about the fact that, PDPA issues. That is a concern, right, for many of the new people who are offering services. And then somebody said they didn't know about Mindline SG, which kind of surprised me because they have been there for some time now. But you have a service called Chat here in Singapore, and there are similar services, Youth Space in Australia. There are other services in the US as well now, where a young person can walk in just to get an opinion on their mental health, where they are not registered, where the details are not taken, where it is not associated with the school. So we need more of, chats. We need them to be all over Singapore, just like we have a number of headspaces in Australia, to cater to these young people so that they feel, once they feel comfortable enough discussing their mental health condition with someone, they can be convinced to go and even talk about it to their counselors, to their teachers, to kind of, lower the pressure when there is a need. So I think these are some important steps that we all have to think about and make it happen.
Thank you, Prof. Maitali. That was, I think, also a very good wrap up. I know that there are many more questions in the Q&A section. I hope that we kind of touched onto most of them. Just a few learnings. And maybe to summarize also for the audience here, there's still lots of stigma out there, and we really need to work all together to kind of overcome the stigma out there. Yes, we are walking towards the right direction, and I think with more awareness within the space, we are really now having this pivotal moment where we can really touch onto mental health issues and try to move them forward. We have lots of digital innovations out there, the Bonfire Health and the Safe Space of this world. We're actually trying to target exactly some of the concerns people are having out there, and we definitely need more ventures out there. I was showing in the beginning, there's still too little players in the mental health space out there actually trying to overcome it. There are lots of governmental interventions already in place, with Mindline actually also trying to help people getting connected and actually talking up there. We definitely need to look into the medias and what the medias are doing. We need to overcome the issue of having so many false media, negative media out there, actually more bringing the focus towards the positive side of it, and actually trying to increase the awareness of it, and how talking up about mental health issues can actually not only make you feel better, but make everyone around you also feel better. I think with this, I need to give back, if I'm not mistaken, to the SGInnovate people for us to close off for today.
Yes, thank you so much, Dario, Antoinette, Maitili, Janice, and Kenneth for sharing your insights and experiences on the state of mental health in Singapore. And also, we'd like to thank our partners, HealthTEC Singapore, and all our attendees for joining us and being interactive with your many questions. It's too bad we don't have enough time to cover all these great questions, but please, we hope to continue this conversation offline, and we hope there will be a lot more awareness and acknowledgement of mental health, and a lot more innovations and research tapping on the great potential in the mental wellness space. If you'd like to revisit the conversation, we will be sending a post-event email with the recording to the session. Do also connect with us on our various social media channels, and we do hope to see you at future events. Have a great weekend ahead. Bye-bye.
Bye.
Bye.
Thank you.
Bye.
Thanks.
Thanks.
Thank you so much. Thank you.